Hello everyone. In this video, we're going to provide a comprehensive and specialized overview of gastric ulcers. Gastric ulcers, or more precisely peptic ulcers, are a common problem in the digestive system that can lead to severe pain and various complications. Join us as we delve into the anatomy of the stomach, causes, symptoms, diagnostic methods, medical treatment, and preventive measures for this condition. Anatomy of the stomach. To better understand gastric ulcers, we first need to familiarize ourselves with the structure of the stomach. The stomach is a muscular and hollow organ located in the upper abdomen, below the diaphragm. The stomach is divided into four main parts. Cardia, the area where the esophagus connects to the stomach, located near the heart. Fundus, the upper portion of the stomach, situated to the left of the cardia. Body, the largest part of the stomach where most of the digestion process occurs. Antrum, the lower portion of the stomach, located before the pylorus. Pylorus, the outlet of the stomach that connects to the duodenum, the beginning part of the small intestine, and contains a pyloric sphincter to control the passage of stomach contents into the duodenum. Causes of gastric ulcers. 1. Infection with Helicobacter pylori. Mechanism: this bacterium can penetrate the stomach's mucus layer and produce enzymes such as urease, increasing the level of ammonia, which damages mucus cells, leading to chronic inflammation and ulcer formation. Transmission: through consuming contaminated food or water or close contact with an infected individual. 2. Nonsteroidal anti-inflammatory drugs use. Mechanism: NSAIDs like ibuprofen and aspirin inhibit cyclooxygenase enzymes, reducing prostaglandin production. Prostaglandins play a vital role in maintaining gastric mucosa. Their reduction leads to decreased mucosal protection and increased ulcer risk. 3. Other factors. Chronic stress may increase stomach acid production. Alcohol and smoking can weaken the gastric mucosa and increase acid production. Poor diet, consumption of spicy and acidic foods can exacerbate symptoms. Symptoms and signs. Gastric ulcers may present with the following symptoms. Epigastric pain, burning or discomfort in the upper abdomen, which may worsen or improve with eating. This pain is typically more severe between meal times. Bloating and feeling of fullness, even after consuming small amounts of food. Nausea and vomiting, sometimes with blood, indicating bleeding. Dark or bloody stools, indicative of ulcer bleeding. Weight loss and decreased appetite, due to chronic pain and discomfort. Diagnostic methods. 1. Esophagogastroduodenoscopy. Gold standard, a flexible tube with a camera is inserted through the mouth into the stomach. This method allows direct visualization of ulcers, biopsy sampling, and diagnosis of H. pylori infection. 2. Diagnostic tests for H. pylori. Urea, breath test, the patient consumes a urea solution. If H. pylori is present, urea breaks down into ammonia and carbon dioxide, detected in the patient's breath. Stool test, for the presence of H. pylori antigens or hidden blood. Blood test, for H. pylori antibodies. 3. Barium radiography. Alternative method: the patient drinks a barium solution, and imaging is performed to visualize the shape and condition of the stomach and duodenum. Medical treatment. 1. Antibiotics. For H. pylori infection, a combination of 2 or 3 antibiotics such as amoxicillin, clarithromycin, and metronidazole or tinidazole is prescribed. 2. Proton pump inhibitors. Medications, such as omeprazole, lansoprazole, and esomeprazole reduce stomach acid production and help heal ulcers. 3. H2 receptor antagonists. Medications, such as famotidine that reduce stomach acid production. 4. Antacids. For temporary relief, to neutralize stomach acid and alleviate pain. 5. Mucosal protectants. Medications, such as sucralfate that help protect the gastric mucosal layer. Prevention. 1. Hygiene practices. Washing hands and consuming clean water and food to prevent H. pylori infection. 2. Cautious NSAIDs use. With physician consultation and accompanied by food or protective medications like PPIs. 3. Avoiding alcohol and smoking. These substances can weaken gastric mucosa. 4. Healthy diet. Avoiding spicy and acidic foods and consuming a light and balanced diet. 5. Stress reduction. Using stress management techniques such as meditation, yoga, and exercise. Possible complications. 1. Bleeding. Gastric ulcers can lead to internal bleeding, which may cause anemia and even hemorrhagic shock. 2. Perforation. An emergency condition requiring immediate surgery. 3. Obstruction. Large ulcers can cause obstruction of the gastrointestinal tract, leading to nausea and vomiting. 4. Gastric cancer. Chronic infection with H. pylori can increase the risk of gastric cancer. Conclusion. Gastric ulcers are a common but serious condition that requires accurate diagnosis and treatment. By following medical recommendations and making necessary lifestyle changes, gastric ulcers can be prevented and effectively managed. If you experience any symptoms of gastric ulcers, be sure to consult a physician for a precise diagnosis and appropriate treatment. Thank you for joining us. We hope this video has been informative for you. If you have any questions, feel free to ask in the comments section. Don't forget to like the video and subscribe to our channel to stay updated on our future videos. Until next time, take care.